My name's Amanda and I'm a patient with scleroderma. Scleroderma is a complicated condition. It can impact people very, very differently. For myself, I've become a double amputee. My skin has been very, very tight, limited hand mobility. I have issues with my lungs. Each person has different signs of scleroderma, so some have heart involvement, some have kidney involvement, others really bad restricted mobility as well. I've had scleroderma for more than 35 years. That's a very, very long time. So I started to get sick when I was 9 years of age. It took them about 2 years to diagnose me, so I was thrown back and forth up from country Victoria up to the big city, back and forth to different doctors trying to figure out what it was. They decided that they would do a skin biopsy. They were thinking that it was scleroderma, but at that point, 35 years ago, diagnosis was very, very hard and difficult. So doing a skin biopsy on my thigh, which was obviously positive to scleroderma. The biggest impact for scleroderma for me is fatigue. And I'm one of those people that like to keep busy. So I have lots of daily activities and have my own business, obviously president of Scleroderma Victoria, always doing lots of different things. So fatigue is my biggest impact. Obviously as well, having double amputee, not having the mobility that I need to. So sometimes my tiredness is extended because I am a double amputee and I have to rest and use a wheelchair, which again, I face other barriers in society like access to public transport, buildings, going out to restaurants, all those sorts of things as well. The other thing with scleroderma too is because I actually don't look unwell, people don't realise the impact of my day-to-day struggles. Things like fatigue, walking long distances, etc. My lung capacity. Those are the things that you can't see, so that makes it quite difficult for people to actually understand scleroderma. To improve quality of life for people with scleroderma, I think advocacy needs to occur a little bit more at the federal government level. We seem to get missed out a lot on research funding, and the awareness isn't there, so we're not quite at the place that we need to be. We need as many people as possible to get on board with us to help us with advocacy and also creating the awareness. To someone who's first being diagnosed with scleroderma, I think that the loneliness can become overwhelming. Don't do your Google searches, try not to self-diagnose and get into that state where you get too much information. Reach out to an organisation like us, Scleroderma Victoria, have a conversation with people with scleroderma, join some support groups, and try to get connected with real people rather than doing a remote Google search. Sometimes that can become way too daunting and overwhelming. First diagnosed patients with their medical support, it's good to get a stream of doctors and make sure that you have collective care. So because of the complexity of scleroderma, like for myself, when I had my legs amputated, my rheumatologist wasn't involved in that process. I had a surgeon, and it caused quite long-term complications, whereas if I had my rheumatologist involved at the beginning, that would have assisted me further in regards to how we dealt with that scenario. So having a collection of doctors, whether it be rheumatologists, dermatologists, respiratory, all the doctors need to be connected and to be able to communicate with each other. My family and friend network has been quite developed over the years. So in being diagnosed quite young with scleroderma, it was quite hard through high school, very isolated. I was teased, so making friends was quite difficult throughout my high school years. Very persistent, I've developed a lot of networks and friends over the years and moved around in different places where I've lived. So from growing up in country Victoria to moving up to the big city, kind of enabled a little bit more of networking, friendships, and also just extended supports. I've been pretty lucky.